Imagine an AI system.
Yeah.
One that's proven to be significantly better at diagnosing really complex health conditions than human doctors.
Yep.
Sounds a bit like science fiction, right?
But maybe not for long.
Well, exactly. According to some pretty groundbreaking new research from Microsoft, it's moving, well, rapidly from just possibility into something much closer to reality. So today, we're taking a deep dive into Microsoft's really remarkable new artificial intelligence system. It's specifically engineered for these, highly challenging medical diagnoses.
That's right. And our source for this, well, it's truly fascinating stuff.
Yeah.
It's a recent article from The Guardian published just this Monday, June 30, 2025.
Okay.
And it details Microsoft's claims and, the tech behind this pretty innovative leap.
Okay, so our mission then, for you, our listener, is to unpack exactly what this system is, how does it function, its incredibly impressive performance against human experts, we need to talk about that, what it could genuinely mean for the future of healthcare, and maybe crucially, why it's not quite ready for your next doctor's visit.
Right, not just yet.
We're going to search for those surprising facts and those real aha moments, the kind that make complex topics click and actually stick with you.
And what's really insightful about Microsoft's approach here is how they tackled this. They specifically moved away from just using, say, traditional multiple choice tests,
Okay.
arguing that those can kind of overstate an AI's competence because they mostly favor memorization.
Right, just recalling facts.
Exactly. So instead, they developed a system designed to, well, imitate a panel of expert physicians, doctors grappling with what they call diagnostically complex and intellectually demanding cases.
Okay, that's a really crucial distinction then. So this isn't just about rote memorization, like you said, spitting out facts. How does their system actually ensure it's performing genuine step-by-step reasoning?
Yeah.
How does it act like a real-world clinician rather than just, accessing a giant database?
Yeah.
What's the secret sauce here?
Right. Well, that's where the design gets really clever. This new Microsoft system uses over 300 complex case studies. They're sourced from the prestigious New England Journal of Medicine. We'll probably just call it NEJM.
Okay, NEJM. Got it.
And they transform these cases into interactive case challenges. Now, the NEJM, it's renowned for publishing some of the most challenging, most nuanced medical puzzles out there.
So a really tough benchmark.
Absolutely. An excellent benchmark.
Yeah.
And to do this, they didn't just build one single massive AI. They actually leveraged a whole consortium of existing powerful AI models.
Oh, okay.
Including advanced models from OpenAI, Meta, Anthropic, xAI's Grok, and also Google's Gemini. So a whole suite of them.
Right. So using the best of what's out there already. And this is where we get to one of those really central insights, I think. Microsoft then deploys this bespoke agent-like AI system. They call it a diagnostic orchestrator.
That's the term, yeah.
So this orchestrator is like the conductor of this AI symphony. It strategically works with these other advanced AI models to decide which tests to order, how to interpret the results, and kind of iteratively refine the potential diagnosis.
That's exactly it. It effectively mimics that multi-specialty medical board we were just talking about, collaborating step by step to arrive at the most likely, the most accurate diagnosis.
Okay. And the results, I mean, you hinted they were impressive.
They are, especially when this orchestrator was paired with an advanced OpenAI model. The results are quite remarkable.
Okay.
This system solved, and solved is their term, more than 8 out of 10 of those incredibly complex NEJM case studies.
8 out of 10. Wow.
Yeah. Now compare that to practicing physicians who took on the same cases without access to external resources.
Right.
So no colleagues, no textbooks, not even chatbots.
Right. Completely isolated.
Completely isolated. Their accuracy rate was, well, it was just 2 out of 10.
2 out of 10. That's a profound difference. But okay, let's be fair here. Those human doctors, they were operating without their usual clinical support systems, right?
Yeah.
So is this really an apples to apples comparison? And what does this specific study design tell us about, the real world implications?
It's a fair point, and it's important to acknowledge the study conditions for the human doctors. They were intentionally restricted like that to try and isolate pure diagnostic reasoning under pressure.
Okay.
However, even with that context, the sheer gap in performance, 4 times higher accuracy for the AI system, that's what truly stands out.
Yeah, 4 times huge.
It signals a fundamental shift, potentially, in what's possible for AI in these really complex reasoning tasks,
Mm.
far beyond what traditional benchmarks like, say, medical board exams have suggested before.
Right.
And beyond just the accuracy, Microsoft also highlighted that this AI approach could actually be a significantly cheaper option.
Cheaper. Okay. How does a sophisticated AI system lead to cost savings in healthcare? I mean, healthcare is notoriously expensive.
It is.
How much of a driver for change could this really be on the cost front?
Well, think about the current system, right? Sometimes you have unnecessary tests, unnecessary procedures, often driven by diagnostic uncertainty, or maybe just a need to rule absolutely everything out.
Sure, defensive medicine too sometimes.
Right, and that can inflate costs dramatically. This AI's precision, its ability to order only the necessary diagnostic steps because it's accurately ruling things out or pinpointing conditions earlier, that could lead to massive efficiency.
Okay, I see the logic.
Imagine a future where, fewer redundant tests are ordered, fewer specialist referrals are made unnecessarily, and treatment pathways are just more targeted right from the start. That direct line to a more accurate diagnosis, cutting down that sort of diagnostic odyssey some patients go on, that represents a really powerful lever for cost reduction and, maybe system-wide improvement.
Okay, this definitely brings up a big question about the future, especially when Microsoft uses a slogan like "Path to Medical Superintelligence." That's quite a statement.
It is a bold statement.
Superintelligence suggests something exceeding human abilities across the board. But then Microsoft is quick to emphasize that they believe AI will complement doctors' roles, not outright replace them.
Right.
But if it's so superior diagnostically, isn't there?
Yeah.
Isn't there an inherent tension there?
There is a tension, absolutely. And it underscores a deeper point about what medicine, truly encompasses.
Okay.
Microsoft acknowledges that a doctor's clinical role, it extends far beyond just making a diagnosis.
Right, it's more than just the puzzle.
Exactly.
Yeah.
It involves navigating extreme ambiguity sometimes, building trust with patients, with their families, providing empathetic care, managing long-term patient relationships. Things AI just isn't currently designed or, frankly, equipped to do.
Yeah, the human touch.
The human touch, precisely.
Yeah.
So while the diagnostic prowess is incredible, that human element of medicine remains absolutely vital. They're really talking about equipping clinicians with, advanced decision support for the really tough cases.
Okay.
And maybe even empowering patients with more informed options for routine care down the line.
So no swapping my GP for a Microsoft bot just yet then, despite those impressive numbers.
Exactly. Not yet. While the research undeniably points towards some radical changes coming, Microsoft themselves acknowledge that this work, it's not ready for immediate clinical use.
Right. Needs more work.
Definitely. Further, rigorous testing is needed, especially to see how it performs on more common symptoms, more routine presentations.
Not just the super complex NEJM stuff.
Right, because it really excelled at those complex cases in the NEJM studies, but day-to-day medicine involves a lot of common ailments too. Testing that will be the next crucial step.
Okay, so let's recap then. Microsoft's new AI system, using this clever diagnostic orchestrator and a whole suite of advanced AI models like OpenAI, Meta, Anthropic, Grok, Google's Gemini, it's shown truly superior accuracy in complex medical diagnoses. We're talking over 8 out of 10 NEJM case studies solved. That's huge compared to just 2 out of 10 for human doctors working totally alone.
A stark difference.
Yeah. And while that catchy slogan, "Path to Medical Superintelligence," might, grab headlines, Microsoft is being clear, or trying to be clear, that the AI's role is seen as complementing, not replacing, doctors, mostly because of that broader trust-based nature of clinical roles.
Exactly. And if we kind of connect this to the bigger picture, it tells us something pretty profound, I think.
Okay.
Microsoft's research highlights a system that seems to excel at deep understanding and, crucially, that step-by-step reasoning. It's not just memorization, which is often what traditional exams like the U.S. medical licensing examination tend to test heavily.
Right, different kind of skill.
Very different. So given that, what does this tell us? And maybe what should you be thinking about regarding the evolving definition of intelligence in medicine? And how might our whole understanding of expertise itself shift as AI continues to mature and integrate into healthcare?
Yeah.
Even as it eventually starts tackling common symptoms alongside these really complex ones.
Yeah. Something to definitely ponder as we think about where medicine is heading.